Shoulder dystocia occurs when the anterior shoulder impacts the maternal symphysis pubis after birth of the head, preventing the birth of the body. This then requires additional maneuvers to release the baby's shoulders and effectively deliver the body. Risk factors for a shoulder dystocia include a previous shoulder dystocia in a previous birth, fetal macrosomia, so a fetus over the 90th centile, maternal obesity, so BMI over 30, diabetes mellitus, including gestational diabetes, and labour augmentation, including induction of labours and oxytocin augmentation, and a prolonged first and second stage of labour. Greta is currently in birth suite being supported by her partner Sienna. Greta is a 32-year-old woman, gravida 2, para 1 at 38 weeks gestation. She has a history of a normal vaginal birth at term. She is a positive blood group and GBS negative. This pregnancy is a result of a donor sperm. Greta was induced this morning for gestational diabetes on insulin. She's had an ARM and syntocin infusion commenced, and an epidural was inserted 3 hours ago with a PCEA, which is working effectively. She has progressed well and was assessed as fully dilated at spines just over an hour ago. While she's pushing effectively, her second stage is taking a while. Courtney is currently the midwife looking after Greta now.
Well done, Greta. Nice big pushes into your bottom. That's the way. I can see your baby's head now. So I'm just going to press a button so we can get a bit of an extra midwife in here to help deliver the baby. All right, nice big pushes. Well done. Hello, we're just having a baby here.
No problem.
Big push right down into your
bottom.
bottom.
Just going to get the cot for you.
Just puffing. Well done, just puffing. That's the way, well done.
Okay, all right,
out.
cot's here. Head out, 14, 15.
There's no restitution and there's a bit of turtling, so I think we could have a bit of a shoulder dystocia.
Sure,
Wouldn't mind getting some help there, yeah.
Beautiful.
Greta, I think baby's shoulders are a little bit stuck, so we're just going to get a bit of extra help.
Okay.
Hi, what have we got here?
I've got a shoulder dystocia, do you mind?
Just wiggle down the bed for us. Just
So
wiggle
we're
down.
just going to get you down the bed.
Just wiggle down, that's the way.
Okay, doctors have been called.
Beautiful.
What time was head born?
14, 15.
14, 15.
I'll just scribe for you guys.
Tiani, do you mind helping me with my croquettes?
Yeah, sure.
Okay, Greta, we're going to the next flex your legs up towards your chest. That's it, ready? And go.
Well done.
And with this contraction, I want you to do a big push for us. Ready? And pushing now. Pushing. How's it going, Courtney?
No, I already said that going right down into your bottom, Greta.
That's it.
Okay, that's 30 seconds.
30
Do you want to
seconds.
try Rubens 1?
Yep. Greta, I'm going to hop up and put some pressure on your tummy to
What
help
side
release
was the
that.
back on, Courtney?
Back was on the right
On the
side,
right
right
side?
last.
Okay.
Okay.
How's baby's heart rate?
144.
Beautiful.
Lovely. Well done, Greta. Big pushes for me.
And that's 30 seconds. Do you want to try with rocking?
Rocking, no worries.
Heart rate is 125.
Keep pushing for me, Greta.
Keep pushing.
Okay, that's 30 seconds.
Okay. Do we need an appease?
No, I think I just leeway here. We're a multi-side.
Yeah.
Okay, we'll try
Yep.
Rubens 2 then.
All right, Greta. Good job. So no pushing with this one.
Sorry, it's going to hurt a bit.
Rubens 2 moves the impacted anterior shoulder away from the symphysis pubis into the large transverse diameter of the maternal pelvic inlet. The accouche's hand is inserted into the vagina and pressure is applied to the posterior aspect of the anterior shoulder.
It's 30 seconds. How are we going, Courtney?
No movements.
Heart rate still sitting
Wood screw?
130. Yeah, let's try wood screw.
This maneuver rotates the fetal shoulders into the larger transverse diameter of the maternal pelvic inlet. This is done by the accouche's second hand applying pressure to the anterior aspect of the posterior shoulder to rotate the fetal shoulders in conjunction with Rubens 2. If unsuccessful, pressure can be applied to the posterior aspect of the posterior shoulder to rotate the shoulders in the opposite direction.
You need a hand,
No, I
Courtney?
think I'll be right. I might just try and move the posterior arm if that's 30 seconds.
Yep, that's 30 seconds now.
Okay.
Can you feel for the arm?
Yeah.
Delivering the posterior arm reduces the fetal bisacranial diameter. The accoucher applies pressure to flex the elbow in front of the baby's body, then grasps the posterior hand to sweep the arm across the chest and deliver the arm.
Good job, Greta.
Big push down.
Okay.
Here we go, baby.
Beautiful.
And baby born at 14:20.
Here's your little baby boy. We're just going to take him over to the resuscitators with the paediatricians. Just have a quick look at him, okay? But good tone, good heart rate.
Well done, Greta. Baby's
Good
out.
colour.
Good job.
Hey guys, thanks for
Hey, Claudie.
coming together. I just had a chat to Greta and just had a bit of a debrief with her, informed her of kind of everything that happened, why intervention was necessary and kind of what we did, and just checking that she was satisfied with like the level of care we provided her and if she had any questions, which she did. So answer those questions for her and she's feeling a lot more satisfied about what happened and a lot more, you know, I think she just feels relieved that she understands everything and that it's all over now.
Okay, good.
So yeah, that's great.
And baby's doing well?
Baby's well,
Oh, good,
yeah.
good,
so
good.
just breastfeeding, just put her on for a breastfeed at the moment. So that's
lovely.
awesome. But I thought as a team as well, we should just have a chat about everything that happened, things we think we did well, things we think we could improve on for the future, and just make sure that we're all happy with what
Good
happened.
idea.
So I reckon that we all worked really well as a team. Obviously, being the Acutia and starting off with Greta, I was the leader at the start and was delegating until we got to that internal manoeuvre stage, at which time you, Tiani, became the leader, which I think was really good because otherwise I would have been so fixated on the task at hand that I wouldn't have been able to have that helicopter view to then be able to make decisions and look forward to,
Can you move on? Yeah.
other things we need to implement in order to look after the baby and look after Greta herself. And yeah, I think that was really good.
Yeah, so being the new leader allowed me to plan for anything, like any contingencies that were to happen. So because I was able to look at the whole picture, I was able to see that, for example, peds needed to be called. The resus cot was already a room that you brought in, Julia, which was good planning, just in case baby was to come out a bit floppy, for example.
Which we prepare for in this situation, obviously. Yeah.
It also allowed me to, you know, be the timekeeper, so knowing that 30 seconds for each manoeuvre, I was able to keep 30 seconds for each of those.
Because you wouldn't want to go over that and then get stuck.
And also scribing, so documentation was pretty important, especially in emergency. So I was able to do that as well as lead you, let you know when each manoeuvre was over and to try the next one.
And I think you were a really clear leader in terms of controlling the situation, looking out for any other things that we might have forgotten while you were chatting to the woman, which I think you did well at. I think you and Greta had a good connection by the end of it, so I think you were really able to support her through that.
I guess I kind of had to. You were the Acutia, so you are initially dealing with Greta, but when you are busy doing your manoeuvres, I had to take over. You have to. I'm closest to her. I have to explain to her what's happening when she's so distressed.
And she needed someone to chat to her. You know, she needed to be updated on what was going on.
And just to advise her, you can push with this or you can't. And even again, Tiani did really well with yelling out fetal heart rate. You know, so I was doing suprapubic pressure and I can't look at the CTG. Tiani did really well yelling out fetal heart rate. We knew baby was still well enough to continue, and
I think it's good that we had those regular updates as well, so me saying what the fetal heart rate was, you letting us know whether each, like, the manoeuvre was successful or not, and you also you know, closing the loop of communication by letting us know that
and you did say, because Courtney asked you to call for extra help, call for peds, you came back and you said you've done it. So we all knew that it had been done. And as well, I did ask you if you were alright doing the manoeuvres, if you needed some help. So
good for the situation.
Hopefully that, you know, you felt comfortable that...
I just think, like, I didn't become fixated on it, and if I had it would have been really good to kind of swap over just to kind of give me a bit of a relief and to have fresh eyes on the situation and everything. So I think that was great. I think we managed that well.
And you were clear, you know, you both were loud and clear. We knew who we were talking to when you were asking, you know, you're delegating your task, Courtney. We all knew who you were talking to.
Since you addressed us by our names.
And as I think that going forward, maybe Greta did have a couple of risk factors that could have put her at risk of shoulder dystocia. So maybe as the accoucheur, just recognising a couple of those risk factors and having the receiving midwife come in maybe a little bit earlier, just in case we get in a bit of a pickle where we can have people assisting earlier on, and just being prepared for that. Having a resus cot in there already if we're thinking, you know, there's prolonged second stage or any of those things.
This is true, yeah, because we did have that, didn't we?
Yeah. So I think just for those things would be good. Anything else you guys took from the situation?
I'm just really happy it worked out well.
Yeah,
with a
baby's
good outcome.
alright.
Yeah, it can be stressful.
Yeah.
It's stressful, but I think we did a really good job.
I think us being familiar with, so having worked here for a while now, we're familiar with the room, which is again really important, knowing the environment. So Julie, you knew where the emergency button was straight away. You didn't have to go looking for it. You knew where the resus cot was, so you were in the room with the resus cot very promptly. And in these emergencies, being prompt with that, you can't be delayed by trying to find equipment, which is really again, you only get with experience in the one place, but it was good.
I also think, Connie, you've recognised, you know, the shoulders dystocia very quickly. Like, you recognised it, and lucky you did, because
I'm glad that we got pretty quickly.
Started.
Yeah, you declared an emergency very early, so we are able to escalate the care a lot quicker.
Just glad we had a good outcome in the end.
Yeah, absolutely.
Speaking of which, I should probably go do some obs halfway through that breastfeed.
Have you had some lunch?
Not yet. I got spaghetti bolognese, so it's going to be a treat. But, thanks for having a debrief with me. I hope you guys feel better about the situation now.
Yeah,
all right, we'll go get to those obs.
Good on you.